Hello students, this is a lecture on the pharmacology of the autonomic nervous system, part 2. The adrenergic sympathetic agonists for beta-1 receptors are located on the heart muscle, and beta-2 receptors are located on the lung muscle and the intestines. Direct-acting beta-1 beta-2 agonists for asthma can be selective or non-selective. The non-selective example would be isoproterenol, which has side effects on the heart due to beta-1 stimulation. The selective beta-2 agonist, like albuterol, does not have side effects on the heart. Autonomic drugs are used widely in over-the-counter and prescription medications, and their major effects are easy to predict. Sympathomimetics and anticholinergics produce fight or flight effects. Parasympathomimetics and adrenergic blockers produce rest and relaxation effects. These actions may be therapeutic effects or side effects. As a review, the sympathetic stimulation would cause pupillary dilation, inhibition of salivary flow, dilation of bronchi, constriction of arterioles resulting in increase in blood pressure, an increase in heart rate, a decrease in motility of the intestinal tract, and would also release glucose into the blood. The parasympathetic stimulation would cause pupil constriction, stimulation of salivary glands, constriction of bronchi, dilation of arterioles, which would result in decreased blood pressure, a slower heart rate, increase in GI tract motility, and storage of glucose in the tissues. There are very few parasympathomimetic drugs in use because they have numerous side effects. This class also includes toxic substances such as organophosphate insecticides, or malathion, and nerve gases such as sarin. The mnemonic sludge is used to refer to the pathological effects of massive discharge of the parasympathetic nervous system. Sludge is usually encountered in cases of drug overdose, ingestion of certain poisonous mushrooms, or exposure to nerve gases. The symptoms of sludge include salivation, lacrimation, urination, diaphoresis or defecation, and emesis. Parasympathomimetics stimulate the GI or urinary tract. They can be used to treat glaucoma or xerostomia. Anticholinergics are also known as parasympatholytics. They inhibit the parasympathetic branch. A prototype drug in this category is atropine. It is an acetylcholine antagonist, with most effects being predictable as the opposite of the parasympathetic nervous system. Therapeutic uses of the anticholinergics include pupil dilation during ophthalmic exams, increasing the heart rate for bradycardia, drying secretions as a post-operative medication which slows the GI tract and dries secretions in the mouth and respiratory tract, or bronchodilation for asthma. Common anticholinergics include atropine, Atrovent, scopolamine, and benztropine. These can be used for asthma, motion sickness, or Alzheimer's disease. Sympathomimetics stimulate the sympathetic branch by acting at adrenergic receptors. Most effects are very predictable: xerostomia, stimulation of the heart, and bronchodilation. The primary effects depend upon which adrenergic receptors are stimulated. If the alpha-1 receptor is stimulated, it will predominantly affect the eye, the arteriolar smooth muscles, which would dilate the pupil and increase blood pressure. Beta-1 receptors are predominant in the heart, and stimulation would increase the heart rate and conduction velocity. Beta-2 is predominant in the bronchi and in most synapses other than the heart, arteries, and eye. Stimulation causes bronchodilation and other typical sympathetic autonomic nervous system effects. This diagram shows a comparison between sympathetic and parasympathetic stimulators and inhibitors and their effects. Epinephrine stimulates all 4 types of adrenergic receptors. It is used in cardiac arrest or fibrillation, asthma, allergic reactions, anaphylaxis, and it is also used in local anesthetics to constrict the local vessels and slow anesthetic absorption. Pseudoephedrine and ephedrine stimulate both alpha-1 and beta-2 receptors. It is used orally as a nasal decongestant in the upper respiratory tract infections and allergies. Over-the-counter preparations include Sudafed and Drixerol. They may cause a dry mouth. Ephedrine is the primary component of the Chinese herb mahuang. Isoproterenol, or isoprel, stimulates both beta-1 and beta-2 receptors. It is a cardiac stimulant which increases the rate, force, and conduction speed of the heart. It can also be used for acute bronchospasm in asthma. Pure beta-2 agonists such as albuterol and salmeterol have largely replaced isoprel since these agents have fewer cardiac side effects. Other indications include angina, hypertension, dysrhythmias, and migraines. Amphetamines are indirect-acting sympathomimetics. The chemical structure of amphetamine is similar to epinephrine. Because they cause significant CNS stimulation and have dependence potential, their medical uses are limited. It is used to treat narcolepsy and for attention deficit disorder. Cocaine and methamphetamine are drugs of abuse. Indirect acting agonists, such as amphetamines, release or enhance the action of a neurotransmitter. Adrenergic blockers are also known as sympatholytics. They inhibit the sympathetic branch. Therefore, their actions will generally be close to the parasympathetic. They may block alpha or beta receptors or both. The effects of the blocker can be predicted by knowing which receptor it blocks. They are the most widely prescribed class of autonomic drugs. Alpha-adrenergic blockers are used for the effects on vascular smooth muscles. The relaxation of vascular smooth muscles causes vasodilation and a decrease in blood pressure. They are mainly used for the treatment of hypertension. Common drugs are Cardura or Hytrin. Beta blockers may be non-selective, which means they block both beta-1 and beta-2, or selective, which means that they block beta-1 only. Propranolol, or Inderol, decreases heart rate, force, and conduction velocity and is used for the treatment of dysrhythmias. It reduces blood pressure, it reduces workload on the heart, and it also helps with migraines. Cardioselective beta-1 blockers include atenolol for hypertension or angina, metoprolol or low pressor for hypertension, or toprol for glaucoma. Be sure to know and understand the following key terms: autonomic nervous system, neuron, neurotransmitters, agonists, antagonists, sympathomimetics, sympatholytics, cholinergic, and anticholinergic. This concludes Lecture 2 for Pharmacology, Chapter 3.